Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.
And I'm Fred Goldstein with Accountable Health, here working with employer groups to help their employee benefit programs look at their overall health of their employees. So Nick, another week with COVID. One of the things that we're really beginning to see now, and a lot of concerns regarding pregnant women and whether or not they should get vaccinated. I understand there's some new information out about that.
Well, I think the good news is that the FDA is saying, previously it was, we suggest it would be a good thing, but they're now actually saying this is an advisory. We want pregnant women to take and have the vaccine. We know that it's safe. I know I hear a lot of times that, you know, there's concern about it. How could you possibly know that it's safe? Well, we know it's safe because we had a bunch of people that got pregnant who would have been excluded from the original trials that we did with these vaccination studies in the very early stages, but because they managed to get pregnant, you know, they were already in the trial. They would have been excluded. They were supposed not to. And we saw data from that. And then they've actually studied it subsequently. And I don't know about you, but I do know some mothers, and this is a big concern. So the fact that this is now a safer option, good news for the mothers, good news for the babies as well, because I'm willing to bet there's going to be some transmissibility of the immunity, because that's what happens. Mothers are so good like that. They give it to their babies, right?
Absolutely. And we've also seen, obviously, as the hospitalizations have risen, that we've seen a rise in the number of pregnant women who are unvaccinated being hospitalized and getting severely sick from this.
That's exactly right. So fantastic news. Now, just before we continue, Fred, this isn't Photoshop that's put us together this close, is it? There's a reason we're wearing our masks, right?
Yeah, we're actually at the HIMSS conference. And actually the way this was set up, which is good, it was mandatory vaccines and then have to wear a mask at all times.
Yeah.
So we're in the exhibit hall. They've spaced it out a little bit better. So good approach, I think.
So we're a little bit closer, but that's because my arm isn't long enough, and that's the only way we could do this.
Absolutely. So getting on with vaccines also, the other issue that came up that we've been waiting for a while is, what about the children?
Yeah,
and
this
I understand
is fantastic
under 5
news.
and up, right?
Yeah, 5 and up. Now, it hasn't quite come out. I think it will be out very soon, but there's clear data, clear studies showing that it's safe for 5 and up. So that means that we've got all of these parents who are incredibly worried about their children. You know, they want to have masks in schools. You know, there's all of this struggle, and it's because the kids couldn't get the vaccine. They weren't authorized. We didn't have an authorization, but now we've got the authorization, or we will do shortly. That's fantastic news.
Yeah, especially schools are opening, so once that comes out, hopefully fairly soon, we'll be able to quickly ramp that up and begin to get a little bit safer environment for those children back in school, not just wearing masks if possible, but getting a vaccine, obviously.
Yeah, so let's talk a little bit about masks. That's creating an awful lot of fuss and bother. I was just shocked. I saw a teeny bit of the news, and there's people actually shouting at folks who are wearing masks. So you and I would be shouted at because we've got this mask on.
Right.
I've got to say, I struggle with this whole perception that, you know, somebody that wants to protect themselves, protect other people, if they're making that personal choice, forget whether it's a mandate or not. When did we stop being human beings?
Yeah, I'm not really sure that it's okay to practice safe behaviors, and we sort of push that as a culture and a community, you know, to wear your seatbelt, to watch when you're crossing the street, all those kinds of things, but to wear a mask to protect you or others is just different. I'm not really sure where that came from.
Would somebody shout at you if you put in a car seat for your children and said, wow, that's outrageous, you shouldn't have to do that?
Absolutely.
It's just bizarre. I mean, what is going on in this world? It's really strange, right?
Well, perhaps you, as originally an outsider from the UK, can understand what's going on with this American culture here better than I do.
You must be out of your mind. And I'd like to say that we're doing a fantastic job in the UK, and you know, things that I think are not bad, but I'm pretty sure that they guessed their way out of some of it. They were pretty lucky with some of the choices. They made that choice with the 2-part vaccine and only giving the first one, not per. Actually worked out. It was great news.
Oh, the longer dosing, you mean?
Yeah,
for the second dose?
They took the second dose and said, we're going to spread it out. We want to get more people with their first dose. And I actually think it worked out, but I'm not sure that there was good basis in science for that at the time.
Right.
Now I think we're seeing more of it, and you know, that's the thing about this. Every day you and I learn something new, right?
We absolutely do. It's just fascinating to try to keep up with it because it is changing so rapidly.
Yeah. So in terms of conference and the experience here, you know, what would you say? I know I've got some thoughts, but what are your thoughts?
Nervousness was definitely early on. I felt a little bit better. I've tried to really be ultimately careful. So it's an interesting experience. Obviously, we have to learn how to live with it. And by live with it, I mean, you don't just throw everything to the wind and say, oh, we're just going to go and do everything. But how do we safely function and do the things we need to do? And I think masking and vaccines obviously is the key at this point.
Yeah, and the other thing that I would say, here's my big struggle at this conference. I can't recognize anybody. I mean, who are you again?
Exactly.
My capacity to actually recognize somebody from that small amount of space is just very limited. Now, maybe if I was 20 years old and, my eyesight was better, I'd be able to spot it. Some people have spotted me. I'm, accused occasionally of looking like Gordon Ramsay. I guess I have the hair going on and whatever.
Yeah.
But I've missed people. And I have sometimes occasionally folks coming up and saying, hey, it's good to see you, but I'm not getting that interaction. That's my big complaint. And I think maybe we could put badges with pictures on, right?
Yeah, I think the idea of if you're running a conference or something, think about a badge with a bigger picture of somebody's face. Because even us with my glass, I need my glasses to see the little bitty pictures on some of these. So
yeah, and you can't read the text either.
No.
And they did that in some of the hospitals. I saw that with some of the physicians and nurses. Because they were all covered up, they had no connection with the patients. What did they do? They actually put it, and they have pictures, and they were sticking. I think they printed them out at home.
Yeah,
that's actually not a bad idea.
It's a great idea
right?
to communicate with. And speaking of hospitals, obviously we have seen this huge increase in hospitalizations. Obviously starting in Missouri, but now Florida, Texas, Mississippi, and the other states. Just unbelievable to watch this.
Yeah. So hospitals are filling up in certain areas. We've got to stay on top of this. It's not over. It ain't over until it's over. I forget what movie that's from. Somebody will know, but...
Yogi Berra.
Oh, there you go.
Great baseball player.
Oh, so it wasn't a movie, it's baseball.
Yeah.
Sorry, don't know anything about that.
All good. But yeah, really, it ain't over. We sort of thought in the summer we were heading into a better period of time, but we missed it, folks, unfortunately. It was a race between the vaccine and Delta variant.
Yeah.
And right now, it's obviously the hospitals are struggling, and anything we can do to keep the hospitals from having this influx of patients, especially right now, is critical.
Yeah, it's raging through, especially the unvaccinated. So if there was one message to leave everybody with, get vaccinated, right? If you're not.
Absolutely. So with that, this is Fred Goldson, Accountable Health. Thanks so much for joining us this week. If you'd like more information, please go to accountablehealthllc.com.
And this is Dr. Nick. I'm the Incrementalist here with incremental insights for better business, better health.